Welcome to my channel. Made Insights. Peptic ulcer disease has various spectrums. It can present as ulceration in stomach and duodenum, gastroesophageal reflex, etc. Many drugs have been utilized to treat such illnesses. These are antacids, H2 receptor antagonist, sucralfate and others. Most potent acid inhibitors to be used are proton pump inhibitors. Proton pump inhibitors available in various forms like omeprazole, pantoprazole, rabeprazole, esomeprazole. Worldwide, they are being used very frequently. Use of PPI has increased 456% since 1990. Even it is available over the counter in many countries. Uses of proton pump inhibitors. Healing of erosive esophagitis, symptomatic gastroesophageal reflux disease, eradication of H. pylori negative gastric and duodenal ulcers. Maintenance of healed duodenal ulcer, treatment and prevention of NSAID-induced ulcers, treatment of Zollinger-Ellison syndrome. And also used as co-therapy in GI bleed. Though these are scientifically recommended uses of PPI, but many people take for variable other reasons. Abuse of PPI must be prevented. Abuse may be at the level of inappropriate indication, inappropriate dose, inappropriate duration or over-the-counter sell. Adverse effect of PPI. Fractures. Prolonged use of PPI has been found to be associated with hip fracture, fractures at the wrist and vertebral fractures. Mechanism: the high pH in the stomach causes poor absorption of calcium, leading to bone demineralization. Longer the duration of PPI consumption and greater the dose of PPI, higher the incidence of fracture. Iron deficiency anemia. High gastric pH is responsible for poor iron absorption. Those who have low iron reserve develop iron deficiency anemia. Iron deficiency anemia can cause fatigue, breathlessness, headache, palpitations, hypomagnesemia. Like calcium and iron, magnesium absorption is also dependent on adequate acid secretions in the stomach. PPI suppress the acid secretion and due to which hampers the absorption of magnesium. Symptoms of mild hypomagnesemia include tremors, teny, muscle spasms, muscle cramps and or numbness in hands and feet, abnormal eye movements, nystagmus, fatigue and weakness. Symptoms of severe hypomagnesemia include generalized tonic-clonic seizures, delirium, abnormal heart rhythms, that is arrhythmia. Vitamin B12 deficiency. Absorption of vitamin B12 is very much dependent on gastric acid secretion, hence prolonged suppression of gastric acid by PPI can lead to vitamin B12 deficiency. Vitamin B12 deficiency symptoms. Tiredness and fatigue due to anemia. Headache, most commonly reported symptom. Depression. Low focus, disturbed mind. Neuropathy, paresthesia. Infections. Infections are mostly observed in elderly people. Infection by Clostridium difficile has been detected in higher frequency among PPI user. Also, community as well as hospital-acquired pneumonia and spontaneous bacterial peritonitis has been observed among PPI user. Hypergastrinemia. Due to persistent acid suppression, neuroendocrine cell hyperplasia takes place, causing hypergastrenemia. This can cause carcinoid tumors. It has been seen in animals too. Drug interactions. Omeprazole and esomeprazole reduce the effectiveness of theophylline, ketoconazole, phenytoin, warfarin and clopidogrel and enhance the action of diazepam. If clopidogrel and PPIs are to be taken, they should be given at 12 hours apart. Addiction. Once a patient takes PPI, for long time it becomes difficult on his part to leave it. This is due to rebound acidity and related discomfort. Often the rebound hyperacidity lasts for 2 to 4 weeks. Conclusion. Take-home message. Proton pump inhibitors are wonderful drugs for treatment of acid-related disorders. But if not properly given and if not stopped in right time, it may cause several problems. It should be taken for short duration, only when it is indicated. If a patient taking it for several years, it can be discontinued under the guidance of treating doctor. Lifestyle modification to reduce acidity. Take timely and adequate sleep. Avoid late night food. Avoid spicy foods, deep fried foods, junk food. Avoid excessive tea and coffee. Avoid carbonated drinks. Avoid or stop smoking and alcohol intake. In obese person, weight reduction is helpful for reducing acid reflux. Use of fiber diet and do regular walk or exercise. Thanks for watching. Hit the like button if you like the content. Do not forget to subscribe the channel.